Hello and welcome to my channel. This is Bedside with Dr. Faraja, and today ninapenda to discuss kuhusu vital signs. Remember, Bedside is for it's a platform for our discussion on our clinicals, how to improve our clinical practice kwa wagonjwa wetu. Kwa hiyo today we want to discuss about vital signs. Now, why do I want to discuss about vital signs? I want you to know that actually vital signs is something in medicine that is very informative about your patient. Kwanza, inakuwa ina taarifa nyingi sana za muhimu kuhusu mgonjwa wako, but it's one thing ambayo unaweza ukaitumia ku save a life or to rescue it from getting bad. Yani kama mgonjwa wako anakuja, halafu hali yake inaelekea kuwa mbaya, ni rahisi sana wewe kugundua kwa kupitia nini? Vital signs. So it's important for us to know what are the vital signs, how to assess them, why are they important, and how to use them in any circumstance. Na hivyo ndio vitu ambavyo tutaviongelea siku ya leo. Sasa the first thing ambayo nitapenda ufahamu ni kwamba vital signs, the job of vital signs is to measure the most important functions of the body. And these are the things that will change very early in a patient if anything is going bad in their body. There are 5 main important vital signs, lakini mimi leo nitadiscuss 6, and I will tell you why the 6th one is not vital, but it's very important. So the vital signs that we know the heart rate or the pulse rate, we know the blood pressure, the temperature, the respiratory rate, and the oxygen saturation. These are the 5 documented vital signs ambazo zimekubaliana, na kumbuka hizi ni signs, kwa hiyo ni vitu ambavyo unavipima. And then the 6th one ambayo mimi nimeiongeza ni Glasgow Coma Scale. Glasgow Coma Scale, kumbuka, sio kipimo. This is your examination and your own calculation. Kwa haijawa included kwenye vital signs, but it's something that is important for you to assess initially in your patient. Kwa include kwenye kundi pamoja na vital signs. Usually Glasgow Coma Scale inakuwa assessed mara nyingi pamoja na vital signs. Kwa hiyo kumbuka, when we are talking about vital signs, ninaongea heart rate au pulse rate, ninaongea pressure, temperature, saturation of oxygen, and respiratory rate. Don't forget any. They are all very important. Every clinician is required to know the normal vitals. Ni kawaida kukuta wagonjwa wasijue pressure kawaida ni ngapi, sijui mapigo ya moyo kawaida ni ngapi, saturation ni ngapi. Lakini for every clinician it is very important, kuanzia wale yeyote ambaye anamgusa mgonjwa, ni muhimu sana kufahamu the normal vital signs. Kwa hiyo nimekuandikia hapo the normals kwa adults, lakini pia unatakiwa kufahamu normals kwa children. Kwa nimekuwekea hapo zote. So normal vitals kwa adults kama unavyoziona, normal vitals kwa watoto kama unavyoziona. So we use vital signs to triage our patients. Now, what is the significance of vital sign? Number 1, it actually tells you about the stability of your patient. Sindio? Vital signs will tell you if your patient is stable or not stable. And if your patient is not stable, that means you have to act immediately. You are not going to wait. Lakini pia, vital signs zitakusaidia ku determine if your patient is going to deteriorate anytime soon. It predicts the deterioration of your patient. So if you have a patient who is very ill, and so the vital signs will be telling you if your patient is deteriorating or is not. So they're going to be predicting the prognosis actually of your patient. Anaenda vizuri au haendi vizuri. Lakini kitu kingine ambacho ni muhimu napenda ufahamu, vital signs zitakusaidia kuamua ni protocol gani ambayo unaweza kuitumia wewe kumtibu mgonjwa wako. There are many different protocols. Sasa tutakuja discuss with time, especially kwa wale ambao ni wa emergency. Lakini kumbuka, vitals, your heart rate, your blood pressure, ndio zitakazo kusaidia wewe kudetermine ni protocol gani ambayo sasa utaanza kummanage nayo mgonjwa wako. So you use the vitals to decide which protocol you're going. For example, a patient who comes in with DKA It's the triage that is going to tell you kwamba unaenda kummanage kama ICU patient au unaenda kummanage kama ward patient, mgonjwa ambaye amekuja na DKA. Lakini vitals zake zitakuchagulia wewe the right protocol ambayo utammanage nayo mgonjwa na jinsi ya kumfuatilia. And then the other thing that is very important about vital signs ni kwamba they will actually give you feedback. If you're managing your patient who is critically ill, how do you know that your management is actually doing anything? How do you know that you're actually doing something to your patient and you're not just wasting your time? It's through the vitals. The vital signs zitakwambia sasa you're giving your patient, mgonjwa wako amekuja kwenye septic shock, you're giving your patient your management, your patient is improving or the patient is not improving. It's the vital signs. So tunasema vitals zitakusaidia wewe ku-assess your own management. It gives you feedback on the management that you're giving to your patient. So kama una manage mgonjwa afu vitals zake zinazidi kushuka, it means you may have to change your protocol or you have to change your management. Kama una manage mgonjwa wako vitals zake zina improve, then you're on the right track. That is how vitals will give you what? The feedback. Now, I want you to know kwamba, and this is the most important part of this talk for today, any change in vital signs should not be taken lightly. Change yoyote. Now, what do you do? The first thing, you have to confirm that actually the change is true. So for example, umenote kwamba mgonjwa wako ghafla saturation imeshuka. You have to confirm kwamba actually imeshuka. So unahakikisha kwamba ulichotumia kumpima mgonjwa wako kipo sawa, kinafanya kazi vizuri. You measure and you realize oxygen ya mgonjwa wako inashuka. Au mgonjwa wako ameanza kupata tachypnea, anahema haraka haraka. Alikuwa hayuko hivyo, ghafla ameanza kuhema haraka haraka. Once you've confirmed kwamba the vital has changed, yani you're not supposed to ignore. It's very important that you respond to every change. Now, how do you respond to the changes in the vital signs? Number one, you have to find out why. Why? The whys of medicine, that's the most important thing, especially in the vital changes or vital assessment. So unaenda kumchunguza mgonjwa wako tena, kutafuta ni kwa nini hiyo vital imechange. So say your patient is alikuwa calm and comfortable and all of a sudden you note kwamba the heart rate has gone high. So you want to know, is your patient still comfortable? Is your patient in pain? Is there anything that is bothering your patient? Amepata taarifa mbovu? Or is a disease that is happening in them? Is the blood pressure going down? Is it that they're getting hypoglycemia? Ni nini ambacho kimesababisha hiyo vital ikabadilika? So it's very important, anytime you see any change, any deviation kwenye vital sign, kuichukulia kama a very significant thing na kuact upon it. And how do you act? Is by finding out why did the vital change. You understand? That's very important. Now, if you do not act, the vitals of your patient have changed and you did not act, what will happen to your patient? It means every time you don't act, you're increasing the chances of your patient's condition to get worse. So if right now they're having tachycardia, you note tachycardia saa 10 jioni, and you do nothing about it, you don't search, you don't find out why, you don't try to correct it. By saa 11 jioni, saa 12, now you find the blood pressure is also gone down. You understand? And if you do nothing about it, after 1 or 2 hours, utakuta na Glasgow ya mgonjwa wako imeshuka, na saturations imeshuka, na mgonjwa wako ataendelea ku deteriorate. You understand? Because it is very important to act upon every time you delay, just know kwamba you have increased the chances of your patients to complicate or to get worse. So it's very important that you act at every vital change. I hope this video was helpful to remind you about vital signs, and on our next video nitakuambia now how to measure, what are the things that you need to do when you're taking the vitals of your patient. So please remember to subscribe and please comment. Let us know what is it that we can do better, and then we will learn together.